I'd like to thank all of you for coming out tonight, because we are going to be having some really great conversations in regards to, as we all know, the issue around safe supply, the addiction and the opioid crisis in Vancouver, in Richmond, and in the rest of British Columbia. We do know that the NDP has one way of taking on how we should be addressing this situation. And I think I would safely say a lot of us disagree with it. We've seen thousands of people who have died. We've seen more and more young youth and children becoming addicted to safe supply. And so I wanted to have an open dialogue and basically bring in some industry experts who can tell you their findings, what they see should we be looking at. And also, we want to have a Q&A, so you can ask questions, what are your concerns, and how you think we should be addressing the situation. So this is all live streamed as well, so please have some nice decorum in here, no swearing, and let's get cracking. So first of all, I want to introduce Dr. Julian Summers. He's going to give a little bit of bio about himself, and then he's going to talk to you about what his findings are. Julian?
Thanks very much, Michelle. Thanks to all of you. As I was coming in to the event this evening, I was reminded that I give a lot of public addresses. I'm a university lecturer. I've taught in faculties of medicine, psychology, and yet this is the first time ever I've come to an event hosted by a candidate for office. And I thought, well, how is that? And yet, starting in 1996 here in BC, I began 25 years of continuous work with the provincial government and intermittently with other governments, federal governments, other provincial and territorial governments. And my identity was always nonpartisan. If you want to know, I've tended to vote center-left, historically, I would say, on issues growing up. And yet, but it never came up in my work. Then all of a sudden, this government heard my advice, as other governments have before. Some take it, some don't. I roll with the punches. And they behaved in a way that's very different from previous governments. And were not only very rejecting, but in a way that made it basically impossible for my research group to continue doing what we were doing. We were ordered to destroy a database. So I realized that my mission, the thing that had motivated me, which is to move from my clinical focus on addiction. I started in Riverview Hospital in the 1980s. I had outstanding mentorship for 12 years in the field of addiction at SFU and then at the University of Washington. And I came back and I started my work. And after about 10 years in clinical work, primarily, BC Children's, Women's, GF Strong, and then UBC, I realized that I could spend multiple careers doing what I was doing, training clinicians, seeing patients, and make very little difference in the lives of people struggling with addiction in BC, because most of the hardships are concentrated among people who are not coming into clinics on an outpatient basis, but are struggling with greater hardships, and they're in places that don't even have clinics. So I had the opportunity, I jumped for it, to be part of a new unit in medicine at UBC, where we provided policy advice to government. That was our whole mission. Everybody agreed with what I said a moment ago. We've got to make big changes, not little changes. So that was the big privilege, the big 20 years of work with the province of BC, linked information, so we knew everything about people who had been identified with harmful addictions, but in particular, those that had been seen elsewhere in government services, especially in our courts and corrections, but in hospitals, detention centers, shelters, who needed income assistance. So we had multiple ministries contributing all of their information, and here's the part I've concluded was very unpopular with the current government. The uncomfortable part was that it's very clear by looking at the sum total of cross-government information that addiction is increasing noticeably among people who are experiencing homelessness and courts and corrections. And in an increasing way, what I mean by that is, on average, the number of reoffenses among people has doubled in the last decade or so, all clearly linked to their substance use and the lack of support that they have. I could really go on. I'm going to try and be super brief though. Another piece of work that I think is relevant to this is Canada's conducted the largest randomized control trials comparing different ways of responding to people who are homeless, involved with courts and corrections, struggling with addictions and other mental illnesses. I led the trials in Vancouver. And the conditions that we compared were offering people choices of housing with support, which, by the way, works the best. Current approaches, which are housing people all together, but with a lot of support in our case. And usual care, the 3 conditions. Here's the high level I want to leave you with. We've written a lot about these randomized trials, published it in journals. But only the option where people had choices resulted in dramatic and sudden declines in future crime, 71% less crime, and dramatic reductions in emergency department visits, over 50%. There were no differences between people who remained homeless and those who received rich, supported housing in a single building. The culture of the building was the culture of the street. And why should we expect any different? The people who got to choose places assimilated. They found opportunities to experience what they usually described, or most commonly described as, I feel like a normal person. They were on average in their 30s, just like the people we're losing today to drugs, on average in their 30s, unemployed, wanting to work, and the 25% that have kids under age 18 want to be reconnected with their kids. So all of my advice to the current government was at odds with what they were planning to do, which was increase SROs, increase consumption sites, not only increase SROs, they don't like that term used, but basically small individual level apartments where you can't have kids, with consumption sites in the building from scratch. That's the design. So my advice was very unpopular. I also pointed out to them that because we have this 20 years of data, benchmarks about what's possible through different interventions, information about where are needs starting in the province, and what happens as a result of the fact that there aren't teams supporting people in Campbell River or Bella Bella. They move. It's very clear. They migrate. But I told them that we could use this information to evaluate the outcomes of new government investments, and that we should do that. Unfortunately, I have also told them in the same presentation that what they had already decided to do was not going to work. So 1 week after my presentation, we received an order to destroy the entire database. I am no longer talking to government the way I have been for the last quarter century, and so I'm here talking directly with you. I will do it with as many parties or candidates across parties as choose to invite me. I remain in my heart nonpartisan, but let me assure you, it is very clear that we are better able to measure and show how we're performing currently, and we are definitely able to perform far, far better with the same economic cost. That work has been done. In my opinion, our main problem is we have been unwilling to spend differently. Okay, so let me end there. Thank you very much for listening.
Hi, my name's Allyson, and I'm a former worker from downtown East Side. I worked in a homeless shelter, a drop-in center. I worked in a safe consumption site, as well as a safe injection site downtown East Side. I'm here tonight because I think it's really important to educate people about the truths that people don't hear about. All the places that I just mentioned, they truly are Band-Aids, just Band-Aids. They're not really helping people. They're not treating what the cause is of when they become addicted, how they become addicted, the traumas they've lived through. Homelessness is huge, especially in Vancouver right now. Financially, very few are able to afford to live in a home. So this creates a community of people who are lower income. And when they get this sense of community and they feel that people care about them, the other people in the community, they do start doing things like they do drugs and together because they're feeling loved and they're feeling cared about, and they've never felt this before. So I'm here to answer any questions about the truth about what's really happening with people in homelessness and addiction, with mental health issues, traumas, and maybe there's a solution tonight.
Hello everyone, my name is Sagert and I am a recovering addict. I've been there, I've done that. For 10 years I used Oxycontin and fentanyl. That was my drug of choice, and that is what is currently killing everybody right now with this so-called safe supply. What it comes down to is there's just not enough services to support everyone. When I mean everyone, I mean people that if you don't have a lot of money in your family, and if you're not able to afford $300 a day, you cannot get help tomorrow. And that's just how it is. You cannot go to a recovery facility and say, I want to get clean right now. I've decided to take that step. I've asked for the help. And that's just non-existent unless you have the money. If it wasn't for a family that cared about me, that loved me, I might not be here today, because that's just the truth of it. That's how serious it's gotten, and it's only gotten worse since 2015 when I attended a 9-month first stage recovery program in New West. The only way we're going to get some kind of change in this is if the government is willing to step up and have a detox facility and a recovery facility in every single city. You can't have it where you go to Richmond Addiction Services and the first 5 minutes of talking to you is, all right, well, would you like methadone or would you like Suboxone? And that's what helps you lose the urge, lose the physical withdrawal of being addicted to opiate. So that's the issue we stand here today with, is the government wants to take the easy way out and put in these safe consumption sites that are apparently safe, but really what it's doing is recycling your addiction. You're just going in, getting high, possibly passing out, overdosing, and they revive you, and then you go back out with absolutely no plan to go into a recovery program or a detox center. So that's why I'm here today, is to let people know, because I've heard a lot of misinformation around here, how safe consumption sites that's going to help everything, and it is not. The government needs to take a strong stand and fund a detox facility and fund a recovery-based treatment program in every city. And until then, you're never going to get any results. It's just not going to happen. So that's why I'm here today. I have no problem talking about this. My philosophy is, if I get my story out there and I'm able to save one life, that's worth it for me. That's what it's all about, is saving lives. And
So I think I'm going to ask each of you a quick question. But first of all, for me, the reason why I'm doing this and why I'm so passionate is I'm very angry that the government is only focusing on harm reduction. There's no real preventative program. So I call it the constant conveyor belt of new people getting onto drugs, and then they're just going through this conveyor belt. And either they can get off that conveyor belt and get recovery and get the help that they need, which is very difficult, or the other end of that conveyor belt is, 6 feet under. And at the same time, at the front of the beginning of that conveyor belt, you've got younger youth and children who are getting addicted. They're getting access to safe supply. They're getting access to drugs. It's point blank, they're getting access to drugs. You've got young youth actually tootling around on their little electric scooters, with their fanny pack selling pot in the schools at lunch hours. And I know this because I know one kid that actually does it. So, found that out 3 weeks ago. So there's not enough preventative programs in place. Children who come from a broken home, or there's abuse in the home, or there's a family member that has addiction or mental health issues, that stability is not there in the home. And there's also so many families, like 25% of the homeless are single parents or families that are homeless. And the government is not focusing enough on building safe homes for families that are, vulnerable. And so that's one of the reasons why I wanted to have this. And this is one of the reasons why we really need to have much louder voice in, protecting our children, saving our children, and having more services in place for prevention. It also includes prevention for crime as well. We're not doing enough around crime prevention. We need to shore up our ports. We need to have more police force that are actually working on gangs as well. So my question, so that's my little rant, but my question is, Julian, what were some of the things that you would like to see if there is a new government that says we're all ears and tell us what we should be doing?
Christmas came early. I would say you recognize you've got a big problem. And you have a big problem because if you're, so government is both the elected side, the individuals that come in and have and declare and seize a new mandate. They change every time we have an election. And there's also the so-called permanent government. The permanent government massively outnumbers the elected government, about 5,000 to 1, or some kind of ratio like that. And if your permanent government has a general cultural view that those people with addictions, they don't really get better. It's a brain disease, it doesn't go away. It's like a management problem. And if the culture is one of that has this sort of very pessimistic outlook, we've actually heard, I'm not going to name people by name, but senior leaders have said this. Then you might think, well, maybe some of them could live in buildings that have vermin, lice, bed bugs. Maybe they could find a way to survive on a couple of $100 a month for food in those conditions. Maybe they could. We couldn't. If you're a BC public servant and you develop an addiction, there's a program for you. It provides rich social and psychological supports, and it strongly discourages you from using any drugs. It's the same type of approach that's taken with physicians, other professionals, airline pilots who develop addictions. If you're poor in British Columbia, you'll be offered drugs. The one thing that the other programs discourage, and you'll receive, as we've heard already, almost no psychological and social supports. It's as though those things don't matter. So step one, and it's a big one, that's why I've spent so much time on it, is you have a big culture problem in the public service that you have to change. Step two is change it to what we've already heard, a recovery-oriented system. That's the term that's being used. It doesn't quite fit, but what it refers to is Based on knowledge that's been gained over roughly 60 years now of sustained research, we know that people are more likely to be vulnerable to addictions if they lack certain opportunities in life, for relationship, for engagement in activities, nothing extreme or weird, just normal things, education, a role in the community, healthy relationships, things to do on a daily basis, right? Things that make life matter. So if we focus on those things, this recovery-oriented system of care, ROSC is the term that's used, that tries to bring all this information. It's taken on that name because the people looking at all this information are trying to think about what's the fastest way we can help all the people that currently have really serious problems. How can we help get them out of distress and despair? And that's where I've been working. But the misnomer is, if we think about our government the same way, that way, it also works for prevention. Because we'll be looking early on for any individual it would be unusual. We'd go outside at Richmond, come home, and we'd say, hey, honey, I saw a person sleeping outside. And you say, whoa, what's up with that? We better do something. Who do we call? There'd be a place to call. And then someone would come and make sure, hey, so that would stop right away. Because that's how we would be, right? That's not that unusual. It's actually bad for us that we've become habituated. I don't know, that we've become tolerant of walking by people out on the sidewalk who are not conscious and we don't know if they're dead. That's become common. Uh-oh. That's not going to look good on the live stream.
It's okay, we'll just leave it down.
Yeah.
So don't worry about declaring a minister of state for mental health and addiction. Whoever is your party leader and is the premier, the buck stops there. That person's job, in my view, thank you again, is that they need to look at everything from the justice system, income assistance, job creation, prosperity, indigenous reconciliation, education, all these things together. And then it would say, oh, well, you mean we're losing a lot of people in their 30s, they're unemployed, we've got big construction demands around BC. I've heard that some people would choose to go to a therapeutic community from the street with addictions because some of them would like the opportunity to earn an in-demand training certificate in a trade while also, for 18 months or so, practicing living each day without drugs. Some people would choose that. Maybe we should do that. Right now, you got jam in my peanut butter, right? We're mixing across ministries instead of functioning in silos. So I would say, think about embracing the opportunity of a cross-government, recovery-oriented system, and first of all, make sure you've got the people in place in those ministries to do it. Alberta Next Door has committed to this 4 years ago, and some of my friends in that government described to me the slow process of realizing that their vision was not being implemented, in some cases at all, but not quickly, because they had the wrong people in government departments. They were resisting. Recently, it's been reported that the government of Alberta did away with a large component, Alberta Health Services, gone. This is part of the contributing reason. Bad culture fit. Okay? We can't wait for a second term. They did this in the second term of their government. We need this to be done in the first 100 days. So I could say more, but those, you get my broad strokes. Urgent change right now.
Allyson, I'm so glad that you came here because we've had some very interesting conversations, and you talked about some of the experiences that you had at the safe injection sites, where yes, you had to save the lives. I'd like you to talk a little bit about that, and how disheartening it is to see the end results when you have, if you know what I mean. I'd like you to continue that conversation that you and I have had.
Okay. Working in site, ingestion site, consumption site, shelter, drop-in center can be very difficult sometimes. Finding staff is really, really hard. It's a really hard job. So there were times where I'd literally be working alone and having to respond to overdoses on my own and try and call for help from other staff members that may be in the drop-in center. And it's especially difficult because fentanyl, usually naloxone, a shot or two works. But if it's bendo, you have to give chest compressions and you have to give breaths. They use the BBM and to give chest compressions until the paramedics arrive. I know there are some very, very special people to me. You know, you don't know until you actually meet a lot of the folks that are downtown East Side, but I have met some of the most amazing folks I've ever met in my life down there. And when they OD, it rips your heart out. I know there's one lady, very special to me. She grew up in residential school. She survived depictions. She was a former sex worker, and HIV, and addicted to heroin. And honestly, when I think about what she went through, the only reason why she lived as long as she did was because of the drugs. Because having to face what she's gone through, I couldn't imagine, right? Because we don't have the help to help these people with what they've gone through. That's a lot to deal with. Anyhow, so this particular lady is so wonderful. I always said my first response, when I first started there, my first response is better not be her. Guess who my first response to an OD was? It was to her. When she took that breath of life, she sat up and she hugged me and would not let go of me for like 10 minutes. And then 2 more times after that, I had to revive her. And the last time I saw her, she told me that she thought of me as a special angel sent from God, especially for her. I never saw her again. She went off site, and because there was no one around to revive her, we lost a very, very special soul. Sorry. It hurts because this woman has never knew what a good life was. And yet, at the same time, she was the happiest, most giving person I've ever met. For going through what she's gone through, and you know, I just wish she would have been able to have a life where she could breathe and, like she said, feel normal. But like I said, those places are just band-aids. So then they go off-site and they die anyhow.
And she had mentioned Willie Picton. I don't know if all of you know who Willie Picton is. Okay, he was a serial killer. 62 women were missing in the downtown East Side, and so there was a lot of missing women, and so she was lucky, that she did miss that. Okay, Alex. So my question to you is, we talk about detox, and we don't see enough detox. And I'd like to get your perspective on how long does it take to get into detox? How long do you have to be into detox? And what kind of support systems are there after you have left detox?
So detox, if everyone knows, it's a place you go to, and there's nurses, registered nurses, there's usually a doctor, and they medically supervise you coming down off of your drug of choice. Some are easier, it's not easier, but more of a pleasurable experience. Some you're in a bed, shaking, cold sweats, vomiting for 3 to 4 days straight, and that is literally the poison leaving your body. So when you go to a detox, sometimes you can't even get in because they're full, and they tell you to try really hard and not use again, and come back tomorrow, or come back in a couple days. Or you get lucky and you get admitted right there when you get in. You get in, you get a bed, it's all government funded, so there's no charge to you. And once you're in, you haven't started your path to recovery yet. Because you get in there, you feel better, and then sometimes you're like, oh, I'm invincible now, sort of thing. Once you pass the detox stage and you're technically clean, you've gone over 24 hours without having the substance in your body. Then there's a social aid worker that'll come and talk to you, and they'll start giving you your options, and then you'll start understanding how messed up our system is, because they'll now say, okay, it'll take about 30 days to 6 weeks for you to get in to a recovery treatment program. It may be private, maybe a private company, like I went to, that also has 75-80% private beds, and then another 20% is your provincially funded beds. So the one I went to had 6 provincially funded beds out of 62 beds. And you were guaranteed at least 3 months, so they give you 90 days to be a part of the program. I was a part of Narcotics Anonymous, and that was a 12-step program. And it pretty much teaches you how to live a life again without using, which is great. But very little people get to actually go to that stage, because once they get out of that detox program and then they're turned away, they just go back to using again. And now that they've stopped using for a week, their tolerance has gone lower. So that tolerance is like how much drugs you can use at a certain time, and then the more you do, the more your tolerance is. Once you get detox, you're back to 0 again. And then you go out and you do the exact same hit of whatever you're doing, and you OD, because there's a little bit of fentanyl in there or something, and you're dead. So the lack of recovery-based options is detrimental to us even getting out of this hole at all. So yeah, without the city or the province initiating a process to actually make it streamlined throughout every city in the world, really, we'll go BC, but yeah, no. The way it currently is set right now is setting everybody up for failure. Unless you have $300 a day, times that by 90 days, or in my case, it was 9 months. It adds up really quick, and either people can't finish the program because they can't afford to continue to stay there, and they're like landlords there. You can't pay, you're out, and then they'll just give the bed to the next person. So unless there's some serious change in the way the government approaches this, we're not going to get the results we want, and more people are going to be dead, and the numbers are just going to continue to rise.
So Julian, is there any other words you would like to mention? I'm going to open up the floor for questions.
I'd rather hear questions.
Do you want to hear questions? Okay. Avery.
Hi, my name is Avery Mann. I'm a resident and voter in Vancouver. And I want to just comment on some of the things that Julian and Alex have said, and then I have a question actually for Michelle. To learn a little bit about the civil servants who you referred to as completely having a culture of not understanding this at all. I had the great fortune of attending Simon Fraser as an undergraduate in poli-sci and criminology, and went on to study criminology at the graduate level. And one of the things that really impacted me in both of my programs was being able to visit jails and prisons where people who had addiction served. And in graduate school, I was able to go over with my program to Holland and study a lot of the methods that they were using there, how they take an approach of on the medical side, not on the criminal side. And so what I learned is that there's really no better way to understand a problem than being there. Part of the criminology program was hearing from people and understanding that not everybody grows up, with a house and a yard and all that sort of thing. And what really struck me is that police officers who I talked to would talk about certain judges who went on ride-alongs and understood and walked the streets of Vancouver and understood that. So I wanted to ask Michelle, if you're elected, what type of program would you put in place to ensure that these civil servants really have an understanding? So it isn't the revolving door of, with all due respect, politicians who things happen or a comment is made and they're gone overnight. What can you talk to us about in terms of ensuring that those people who are really running the government 24/7 can approach this problem in the way that it really needs to be approached? Thank you.
They need a reality pill. And I actually did a Vancouver police ride-along a few years ago. And in one night, there was an OD. Somebody had OD'd in an SRO. I was shocked at the conditions that people lived in the SRO. I'm talking like the showers were black with mold. There was feces and urine everywhere, and blood everywhere. And the beds, bed bugs and everything else. And the government workers need to see that. They need to see this is where they're putting people to live, where they've lost hope. They need to also see the impact that they're having with young children that are being exposed to drugs. So for me, and if they don't want to do it, they're fired. Because they have to have the compassion, but they also have to have the tough love and the common sense, which has completely gone out of the window. So we need to work more closely with the police force, and yes, we need to have the police back in the schools, the police liaison programs. We need to also address the gang situations. We need to have more after-school programs for kids that they don't have the chance to get exposed to the drugs and to the criminal activities as well. We need to have, so there was an incident when I did the Right by Police, for an example. There was a young lady, she was riding a child's bike, not wearing a helmet. The police officers pulled her over because she wasn't wearing a helmet. She immediately freaked out and started yelling at us, saying, "Don't stop me because my pimp is going to hurt me." And they tried to calm her down for 10 minutes, and she refused. And they were begging her, "Please, can you just calm down? We don't want to take you to the hospital because that means we're stuck with you for 10 hours. And they actually had to end up taking her to the hospital because she wouldn't calm down, and so they couldn't do the jobs that they needed to do. So we need to have way more psychiatrists or psychologists, mental health experts on the streets. Like, we need to have more of that, and government needs to see that. So for me, they have to have those experiences in order to make sure these actions are followed through, because paper pushing and ideology, it's killing people.
Sheldon here. I have a few questions, but I'll just start with one. I'm just one of the residents of this neighborhood and one of the people who helped organize the protest at City Hall in opposition to the proposed supervised consumption site. So the first question that I'll ask tonight, I guess, is the language and politics of all of this. You know, many years when Inside opened, we were calling it a injection site, then it became safe injection site. Now it's a supervised injection site. We have overdose prevention sites. We have SROs. We have temporary modular homes. There's actually one just right next door to us, which has caused a lot of problems in this neighborhood. But whenever residents, anyone voices concern to it, then we get a lecture from people like Councillor Cash Heat or Laura Galander saying, supervised consumption site is different than an overdose prevention site. Get your facts straight. Well, why is the language constantly changing? In the last municipal election, some activists were trying to change it to death prevention sites. So why is the language always changing? Why are the goalposts always changing? And how do we deal with this when people just shoot back at us saying, no, you're misinformed, you're uninformed, you don't know what you're talking about?
I'll take that. So it is a losing game being played out much more publicly now. It's the same losing game that has been being played for 30 years, related to addiction, homelessness, other mental illnesses, and crime. Nothing fundamentally has changed. People point fingers. People try to reduce the relevance of research that I'll refer to, let's say, from 5 years ago, by saying, oh, they didn't have fentanyl. Okay, that's a basic misunderstanding. If you're playing Russian roulette and you have one bullet in the chamber, let's consider that heroin. Now you've got fentanyl, okay, let's say it's 5 bullets in the chamber. The problem isn't the number of bullets. The problem is that more and more people are playing Russian roulette. That's the problem. Everything we've learned about overcoming and preventing addictions applies today, and it explains why we have mounting problems of addiction. This shell game of terminology that you're referring to is nothing more than that. By now, it's publicly, I think, quite well established, and I hope very embarrassing to the government, that the measures that are most problematic at the community level, public supply of addictive drugs, proliferation of consumption sites. We have 47, maybe 50 now in the province. Whereas the heralded Portuguese model between 2000 and 2010 reversed what was up until that time in a developed country, the world's worst drug poisoning, street crime, infectious disease transmission epidemic, and mortality too. And they reversed it over a 10-year period with this many consumption sites. It's not because consumption sites are inherently problematic, it's because the need for consumption sites is driven by the fact that in your community you have a homeless drug-using population that does not have a decent place to self-administer drugs. That's a much bigger problem than not having a place to use drugs. It signifies deeper problems. And so the Portuguese responded with housing availability, dissuasion commissions throughout the country, therapeutic communities, which I mentioned earlier, and a fulsome response. And if you have a chance to look at their plan, if you're kind of interested in this level of detail, they mentioned throughout the entire goal, first and foremost, is prevention. But because they had a crisis, their second goal was social reintegration. If you make that your mantra, you can achieve the results they achieved. And we know that this terminology business is a shell game because the government has instituted these practices with a deliberately crappy way of measuring how they're going. By ordering us to eliminate data, they took off the table one of the ways that their investments could have been more credibly and dispassionately evaluated. But they also had no plan internally. As a researcher, rest assured, I'm sure you and I could sit down and come up with lots of good questions about consumption sites. What's the return rate? What's the return rate among people who use them a lot versus a little?
Mm-hmm.
What about other people in the community? Let's get out there and see who's not using them. What are their outcomes like? Safe supply, let's shift to that. Why is there no marker in these medications so that we actually know objectively if they're being diverted and sold in schools? That's not a difficult technological thing to achieve. We didn't introduce COVID vaccines until we had randomized controlled trial outcome results. We have gone an estimated $1 billion down the public supply of addictive drugs track with no credible outcomes at all, let alone randomized controlled trials. So I am convinced, to borrow Sam Cooper's expression, there is a willful blindness in our current government as it relates to these policies, and that at some level they know they're bad, in part because they are the extension of 30 years of bad policies. What's changed is the size of the public spotlight on what they're doing. That's changed, because things have gotten so much worse at the same time. But it's not qualitatively new. So I hope that helps a bit.
I'll just add, if City Council really did care about our citizens, you just got to look to their voting record. City Council voted to do a $520,000 field upgrade at Brighouse Park. Just the infield, no protective fencing. Do you know how much maintenance they're going to have to do on that? All while they're doing this vote, not 50 meters across the street, there was a homeless encampment inside the lacrosse box at Brighouse Park. So you're trying to tell me that they want to actually try and help people, but they're really not when they're voting to spend $520,000 that could potentially bring a detox to our community and help the people that were living in that park. So I'm sorry, but they need to actually ask people that have been through this and know what they're talking about before they make a vote.
You're here, Alex. Good evening, thanks for letting me speak. My name is John, and I'm a business owner and resident in Vancouver, and I've seen firsthand, my business is in downtown, I've seen firsthand what Safe Supply, SRO housings have done, especially on South Scramble Street, where my MMA studio is located across from the Hojo's. It's a disaster every morning at 7. So, there are solutions out there, as Julian said. I'm not sure, and speaking to the audience and to the panel there, Alberta is implementing, under Marshall Smith and Premier Danielle Smith, they're building 10 or 11 recovery-based facilities. They're spending like $20 or $30 million. One of the key points is that you have to be a resident of Alberta, and they're outside of the main city centers. One of the problems we have is that if you do have a recovery place, you come out, you finish your hours of counseling, who's there? Jimmy the drug dealer. Hey Bill, you want some drugs? Hey Bill, you want some drugs? Eventually they're going to capitulate and succumb to the drug use. So, recovery-based models, what are we doing here? We have enough affluence in this province to build them. There's also an organization, for those of you who don't know, and probably don't, and I suggest that you look at it. It's called San Patriano. San Patriano is a recovery-based facility built in 1978 in Italy. They have 22 different trades that they teach you. The average stay is between 2 and 4 years, 79 to 80% success rate. We've also made BC and Vancouver a destination place for all things drugs. We have to stop that. I don't know if your attendees have read anything that Adam Zivo has written, but reading his articles and speaking with him, basically what's happening with Safe Supply is that it is being given out and then sold to drug dealers. Drug dealers then go to the high schools and sell them as dillies.
Yeah.
So the NDP government is actually creating this addiction issue that we have. The kids don't know that it's 10 or 20 times more powerful than heroin. The long-term ramifications of that is this: you think it's hard to find workers now? Just wait in a few more years to try and find people to work. We won't be able to have any. So my questions to the panel is: recovery-based model, San Patriano, Adam Zivo, and what was the other one? Sorry. And what the locations of these facilities. Thank you. Oh, and Alex, I know last door well as my son went there.
I guess what was the question? Do we agree with you? Or?
No, it's answer the question about San Patriano. If you can explain to the attendees what San Patriano.
I'll comment briefly again, if I can. Fill in, please. So San Pat is a therapeutic community. So it's it's one of the most long-standing therapeutic communities. So in the mode of what I was referring to earlier. I've had the privilege or the honor of offering advice to the government of Alberta in these last few years, and visited some of the residential facilities that John referred to, and it's a major undertaking. They're also making it available to people who are serving sentences. But here in BC, the last time we measured it, we're able to measure it. About 75% of people sentenced to custody in BC were previously diagnosed with a substance use disorder, another mental disorder, or both. 75%, and it has been rising. So that's the same in most places, actually, or in a lot of places. It's a very high proportion. And what they've done is made the offer that you can have the location of your sentence moved from regular straight time to a recovery-oriented wing. And there you'll be only with other guys and guards and program staff who are there to support you in your declared desire to leave this place with a much better ability to withstand further drug use. Right? Correct. Doesn't cost any money. Our research includes research on drug treatment court, on community court in Vancouver, and they're absolutely able to achieve marked reductions in crime across the board. Even people who don't finish all of the requirements of these year-plus programs still are at lower likelihood of committing future offenses. So that's among the things we could be doing. Strong, big thumbs up yes for the model. I couldn't help but notice, John, that you picked San Patrignano as your example. Residents of San Pat are permitted each day with their evening meal to have a glass of wine. John is a wine merchant. I don't know if that's a coincidence.
They have other trades there too.
They have other trades, yeah. I think this is more recreational, and not everybody chooses to partake also. So Alberta illustrates a lot of things we could be doing differently. No question we have the affluence and the ability. The way we're spending money right now on services is obviously counterproductive. It creates a make-work project, right? Yep. The reason we're discussing, gosh, should we have vending machines? Should the public be paying for vending machines that dispense opioids in SROs, right? We have that. We're paying millions for the operation of vending machines in SROs because we've got SROs. Because we've isolated people in terrible, terrible conditions that we've heard about that give them no real hope. They're condemned into services that we then find more ways of layering services on top of. It's a very perverse and counterproductive economic model. This is the big lift for people seeking public office. Let me add that it's still really early in our election, the way we go about elections, at least in my experience in DC. We're not like the US. We don't start a year in advance, right? So this is still early innings, and I'm very interested in seeing how different parties articulate messages based on conversations like this one. I have to say, I'm delighted that there is so much interest. The first big tip-off for me was when the BC United, I think it was in February, drafted their plan, which uses recovery-oriented language. And I thought, why in the world would they be doing that in February? Do they think EB's going to call an election, right? Is that why they want to be first to get this? I've been waiting for years for somebody to do that. Why did they do it? And because there wasn't any reason, I think that they, like Michelle and fellow candidates in the Conservative Party, are sincerely linking their political ambitions to addressing this crisis, right? And I know that's why I'm here with Michelle today. So seeing how these plans are developed, BC United's work isn't done. They'll need to further articulate, elements of their plan. But I strongly encourage all of you, I will be doing this, look at party websites, read the details of what's being proposed and based on conversations like this one, and take that information into the ballot box and into your conversations with other people. We have a federal law, I don't want to be preemptively, but we have candidates for office in our midst today, and it's truly an opportunity. I know we're here because of a crisis, but it's also an incredible opportunity I've never seen before in my career for members of the public, intelligent, voting members of the public, to simultaneously come together and decide on a new path for BC. Boy, do we need it, but it's incredibly heartening to see that we're all having this conversation together.
I just want to quickly preface by saying the biggest voice that came out was here in Richmond with the whole safe consumption side. And as I say, you woke the dragon. And that's where I wear my dragon pin. The people of Richmond came out loud and clear. And even though, certain elected officials wanted to demonize the residences of Richmond, they've come out, they want to be well informed, they want to learn, but they also want to see solutions to help people get back onto the road of recovery. So it's not just saying hand out the drugs. It's, they say no drugs, but it is, we sincerely want to find roads where people can find recovery, that they can find a job, and at the same time, crime prevention and protecting our kids in the schools with no drugs. So I'm going to let Allyson.
One thing I want to say about that is people go into detox, right? And she said, do they come out? They've got no recovery place to go to. We're severely lacking. Detox is severely lacking as well. We need more detox centers. I've had many participants come in desperate to go to detox. So you phone the general number, they can any detox center in the Lower Mainland. There is a 2-month wait to get into detox. This person wants to go in that night. So many times they have passed away between that night and getting into detox. And then they get into detox in the hospital. And then they go through kind of recovery in the hospital. They're in the mental health ward. And what does the hospital do? They call a low barrier shelter and asks if there's a bed. That person is walking out of recovery into a place where people are using drugs openly. What is that person going to do? They're going to use drugs. So we need places for people who are coming out of recovery to go to more second stage, right? Yeah, more second stage housing. And again, that is a community. The 12-step program, places like Westminster House and Last Door, they hold their folks tight and make sure it's a community so they always have the support. We need more of that.
When I was at my facility that I went to, their whole thing is we're not locking you in here and throwing away the key. This isn't prison. You have a disease. You're not a criminal. So if you go with the focus that you're going to lock away the key and you're going to force that person to magically get better because you said it works and all this stuff, it's not going to work. Where I went, they literally taught you how to integrate back into society. Because you would literally be using by yourself in your bedroom, in your house, in the back alley, wherever, and you were so out of touch with society, you didn't know how to act without getting high first, and then going with your friends, trying to act normal to a concert or something like that. So when I went to recovery, you had a buddy system. You go out, you talk to your counselor, you tell them your plan. You literally write out a plan. I'm going to be going here. I'm going to be going to McDonald's, and then we're going to go to the community center and work out. We're going to go play baseball, and then we're going to come back. Same thing if we wanted to go, say, to the parents' house for dinner or something that night. You had a plan, you wrote it out, and it reinforced you on how to live again. And without that type of focus, you're just going to have people that are going to resent the process, and they're not going to want to continue on that path of recovery. So we got to focus, this next government's got to focus on reintegrating everybody back into society, regardless of their income bracket.
My name is Steve Pellick. I'm a professor at UBC and Division of Neurology, and I actually study the action of compounds that actually include cannabinoids. But I don't know as much about the epidemiology and the effectiveness of the strategies that are used to treat drug addiction, although I know people who have recovered apparently fully and others that have not and died. So and these are not people that are destitute living in the streets. These are people who have parents that are doing the best they can to help their children through, sometimes in their 30s and 40s even. And I think what comes out of this is we certainly don't want to see an addiction as something that's a criminal act. It's a disease that needs to be treated. But we have to make sure we have effective treatments. So our colleagues are other professors, like at St. Paul's Hospital and the like, must have advised the government that this was a good plan to take things like any drug, including fentanyl, that you could possess 2.5 grams of this, and you only need 1 milligram to kill someone with fentanyl. So I don't understand the logic of that. I don't understand the reason where you pointed out with Portugal that's a success, and that's what we hear about, that safe supply. But it comes with all of these other things that come with it. Are you aware of any other place in the world that's actually made that level of drug available that you can carry, of any narcotic, 2.5 grams? And also, are you aware of any place in the world where this idea of safe supply without having all these other measures taken in concert has ever been applied, and how successful is it? Because we know 1 year into this program, we have 7% more overdoses per capita than we did before.
Yeah, brutal question. So the short answer, an answer first to your core question, any other places, no. My colleagues and I published a review on the decriminalization of drugs and its consequences internationally, and what difference did it make based on other things that were implemented at the same time. So Portugal is now most famously, it seems, known for having chosen to decriminalize penalties for drug possession, but that was entirely in the service of making police encounters with people who are on the street less fraught. That's the whole purpose. A softer leading edge so the police could then direct people to dissuasion commissions, which is all the throughput. So we published that last January. If we published it in a few months' time, we would be including the experience of Oregon, which starkly illustrates exactly the same thing. Decriminalization, we're going to lead the world in creating a path to improvement and recovery, and the key thing was the mismatch between the removal of disincentives for drug use and the provision of activities that made it possible for people to choose not to use drugs. They completely skipped on the latter. In BC is the only jurisdiction we've reviewed where the leadership advocating for decriminalization of possession explicitly said, we don't need to do anything else immediately. Only place. Dr. Henry's alone at the lead of that argument in our experience. And no, there is no other place that has made dramatic changes. The epidemiology, I appreciate your reference to epidemiology. Just what does it look like in the population? If all we see are people that we see in our clinics and develop our impression that way, of course that's meaningful, but it's biased. And in general, it's very, very clear that the people who are most susceptible to drug poisonings are in communities that have overall lower qualities of support for, I'll skip to psychology now, psychosocial integration. That's what my mentor, a gentleman fellow named Bruce Alexander, anchored addiction around, was psychosocial integration. So as psychologists, this helps us explain both why it is that people in what we would regard just objectively as not great neighborhoods are more likely to experience addictions, but also why people who are in well-supported neighborhoods also develop addictions. Before the 1950s, the OG group of narcotic addicts were doctors. For almost a century. It's due to proximity, but it illustrates your point that social disadvantage in a marked way is not prerequisite for addiction. It's hard enough being a human, right? So yes, it can happen to everybody, but there clearly are things that we can do to bring down the probability, and crucially, when we face a poisoning crisis, it's unbelievable to me that, you touched on this point too, 7, 8 new deaths every day. 8 years into a declared emergency, 8 every day. There's no way you can have 8 more deaths every day unless you are continuously putting people at risk. Continuously. It's agonizing to think that through. Where is BC's conversation on prevention? Have you even heard of it mentioned? No. Right? It's unbelievable. And it gets back to one of the points that is, one of the conclusions I've reached. I know you're all thinking this through as well, but I think that part of the explanation for that is a profound ignorance and pessimism among people in government, mainly on the public service side. Can't stop it anyway. Yeah, we can. Yeah, we can. And it's the counterpart to what we're hearing. The pathway back into recovery is the mirror image of what helps prevent harmful addictions in the first place. It's making sure that people are strong members of communities, right? Feel that sense of belonging, feel that sense of pride in health, right? So you raised a ton of good points. Thank you.
My name is Ivan Pak. I'm a resident of Richmond. So first, I want to give gratitude to the panelists and Michelle as well for organizing these very important discussions. And I know that we have been talking to about advocacy to government for policy change, putting more resources into these issues. And but from my point of view, is as an ordinary folk, I have work to do. I have a family to raise. And I want to do something for the community. And first question is I have an invitation because I'm trying to organize a community seminars talking to kids. You mentioned about preventions. I think prevention starts from education, start from young kids. And those kids in school, they probably don't even know how dangerous these drugs are. Yes. And so in the community, as a parent of myself, I want to do something. So I would like to invite panelists, even Michelle, anybody who in today's meetings to talk about how dangerous it is, to getting on drugs. There's no turning back. Okay, and the life will be completely changed. This kind of thing, and I would like to invite you to come to connect with me to do this. I want to do my part, and I need help. And so my question to the panelists tonight is, And apart from this idea I have, okay, any kind of suggestions, any kind of guidance that from your experience. So what should we do as a regular peoples, right? Because I know we need a big resources, from government. We need a change of policy, change of directions, okay, in order to have a big change to solve these issues right away. But it has to be started from some point. And I want to do something, and I would like to have your guidance. Thank you.
So what you need to do is get out and vote. So I would like all of the candidates who are going to be running in next provincial and federal elections, I know some of them are working on the membership and stuff, I'd like you all to stand up and say who you are and introduce yourselves. Right? So I'd like you all to introduce yourselves, and then we need you to vote. We need you to vote.
It hasn't been made official yet, but I'm the candidate for Richmond, Bridgeport.
Right on.
I've been a professor at UBC for 35 years. I've also run 2 biotech companies, and I've worked with the Canadian COVID Care Alliance, dealing with the COVID situation with my colleague here, Dr. Singh. And I feel that with the experience that I've had, I think that I need to do public service, and that's why I'm running.
What party? Conservative?
Conservative Party.
Conservative, okay, I didn't hear that. We got to get that out. BC?
BC.
Okay.
Good evening, everyone. Thank you for hosting today, Michelle. My name is Jody. I am running for MLA for Surrey-Cloverdale. A little bit about my background. I have my PhD in mental health and addiction. And so this panel today touches home because I deal with a lot of people who can't get into the public system and have to find an alternate therapy or a path for their loved ones. Yes, you see young, very young, from 9 onwards, that are dealing with addiction and have no real path or real support. And I think preventative health, a gentleman, I think he left, had spoken about, what is our vision, centers, locations. I think they need to be everywhere, but especially in communities where mental health or addiction isn't spoken about openly or acceptable. I mean, we come from Surrey, there's a lot of Indo-Canadian community members there, and we hide it until it gets to a point where we can't protect our loved ones anymore, and we need more of that support. But I know Alex spoke about, when you need the service, it's not available. Like if you need it today, they're saying come back tomorrow. But I know this lady right here was talking about, sometimes there's people that, pass during that time, pass in the 2 months. We do need that support, and I'm working towards community, and that is why I am running. As we all have our professions. I run a private clinic. I'm not looking for a new career. I'm actually doing it because I see how troubled our province is. But we need you guys to all come out, vote for us, and so we can make a difference.
By the way, that's conservative too, okay? The federal later, okay? Let's do the provincial, okay? Unless you're NDP, which I don't think. Oh, anyway, go on.
I don't want to listen to anyone sometimes.
Go ahead, Han.
Well, that's great. My name is Han Lee. I'm running for Burnaby South Metrotown as an MLA. And today I'm actually very grateful to see all the great people talking about the great things that we can actually make the changes that really require in this province. And especially the drug issues, it's quite a bit of a big issue, especially not just for the people that currently that is experiencing the issue, but it's for the next generation and our current kids that are experiencing in the negative way. So I'm here actually to create those awareness as far and wide as possible that I can. That is a problem, and the fix is required for everybody. And also we'll put out new policies very soon so that we can actually address the issue more directly so that we'll have better future for all of us. So thank you very much for attending today, and yeah, let's vote and do our thing. Take an action. Yeah.
Hi, my name is Dallas Brody. I'm the Conservative Party BC candidate for Vancouver-Quashena. And I wanted to add something to it. I think that we sort of danced around it today, but I think what's really pushing this is that ideology has taken over this whole policy, and we need to get some common sense back into the policies. British Columbians are compassionate, but they're frustrated and exasperated because they're not seeing results for all the money that's being spent. Right now, there are more workers than there are drug addicts, I understand, in the downtown east side and all through Vancouver. This is outrageous. And I actually have started to believe that the people who work down there don't want this thing to be cleaned up because then they lose their jobs. Now that could be wrong, but I really think that I'm really happy that we're having this conversation, Michelle. Thank you so much. So get out and vote BC Conservative in the next election. That's the answer, and join the party. Thank you.
We're introducing the nominees, or
we're on the federal side, but we're conservatives. Thank you, Michelle, for putting this together. And my friend Avery, who told me about this, who's left, I didn't even know this was happening tonight. I started out my younger working life as I ran the Wish Drop-In Center when it was housed in the back of the First United Church on Gore and East Hastings, quite by accident. I won't describe how I got there, but it was really quite by accident, and I ended up running the center for about 3.5 years. And during that time, I was listening to Allyson speak, and I really could, my heart just went out for you when you were talking about the loved ones that you lose. And Picton was prolific during that time. And I found out later that he murdered 20 women that I knew. And it was the most horrific years after that. I was a witness for the Crown prosecution. I mean, it just goes on and on. The horror stories are beyond what you can almost process. And having said that, I can tell you, you were saying prevention. Well, I was working with the Odd Squad when they started many years ago. You can't get funding for any drug use prevention in schools. They don't want that. It's anti. It's you're crazy if you mention something like that. I can remember trying to get more detox beds. There were only 6 detox beds at the time in Harbor Light, 119 East Cordova. And some years later, I was able to go work there. I raised $1 million, and my boss said, if you can raise this money, we'll let you redo the detox, put in some more women's beds. So we did that, got the construction, moved it up to the 2nd floor, and then went to Coastal Health, who said, if you ask us one more time for funding for the new detox beds, we're going to pull our funding on the men's stabilization beds. Like, it was just anti. And they would say, we have a 95% rate of women that go to detox, they don't stay off drugs. I said, well, you let them out into the street. I mean, anyway, so I just wanted you to know, I really was very warmed by what I heard tonight. And I'm glad that everyone's stepping up to run. Because as you mentioned, Dr. Summers, like, the bureaucracy is one part of it, the leaders that are sitting at the table that get elected, it's all important, so we have to work together. Anyway, my hat's off to the BC Conservatives that are pioneering. I'm running in Vancouver Granville. I'm a nomination candidate. I don't have the position.
Well, federal Conservative.
Federal Conservative, yeah.
Hello, everybody. My name is Mark. It's nice to meet everybody, and I'm really glad that everybody got to this room to have a chance to discuss the issues. It's really important for me. Like Elaine, who's a friend of mine, I'm also running for nomination for Vancouver Granville for the Conservative Party federally. So just to give you a bit of background on myself, I had family members that dealt with addictions their whole lives. I grew up around that. So I almost became a psychologist. My background, I took at McGill, I took my BA in psychology. I was accepted all over the place. Long story short, it's been really important to me my whole life, but I think we need to get back to more of a 4 pillars approach where we deal with all aspects of it. So, there is a crime problem that we have to deal with. We've got a revolving door with a lot of catch or release, so that aspect has to be dealt with. We've got to deal with prevention. I like the thought that, who was it that said over here that was talking about education? We've got to get out right there. Really good comment, because it's better if we can prevent this from happening. We can stop people from doing drugs in the first place. So Anyhow, I don't want to get long-winded because politicians have a tendency to do that. I won't. My name is Mark Bowen again, and hopefully you can all vote Conservative in the next election federally. We're going to see a sea change in government happening, and that's really going to be important if we're going to affect this problem. Thanks.
I just run around. Any other questions?
Yeah, you'll run. Oh, I think there's one, there's two more questions.
Two more questions? Two more questions? Okay, so
Yeah. I first like to thank you and Alex and Stu, sorry, I'm skipping the name. Sheldon, for leading the ground operation along with others for the opposing the Richmond City Council proposal. I was almost shocked that entire council will turn against its own people. I work across the street. My name is Adi. I work across the street at a Crown Corporation, who shall not be named, and I know exactly what. Doctor, you are saying about needing the right people in the right places. It's important to make any change, not just this one. It's very giant change in thinking and what have you. But your opposition, the NDP, has spent decades, if not close to a century, to have this incestuous relationship with the unions, the media, special interest group. That was the reason Mr. Kashid was able to bring this motion and win it. Not just bring the motion, but win it 7-9. We were saved by skin of teeth. Like you said, the dragon arose and then they were looking at it and they were fearful, they just walked back. So they were able to pull VCH out of that and they threw Mr. Kashid under the bus for upcoming October election, I believe. What do we learn from this experience? That's my question, right? So how do you plan to not become a party of elite and bring those enemies into fold, make good relationship with the unions and the special interest group, despite stopping that gravy train, like you said, right? Unlimited tax money, we just keep paying and they just keep spending. Going from 2 seats to 47 seats is also going to be a little bit challenging. I'll be very blunt and honest. I'm not part of the party, but I can see that happening, right? So how are you going to pull that miracle almost without, like, influencing without the authority? I'm sorry, whoever wants to take this question.
Okay, I'll do the political. He's going to do the other side. So on Saturday, there was a session that Kevin actually was the host of, and was talking about how do we get the community to be engaged with the government. And I honestly believe that the government they're just not listening to you anymore. And that's why I was so proud where people in Richmond were very vocal and they were forced to actually listen and reverse their decisions around this exploration of a safe consumption site. We need to have the blue wave. We need to have people come out and vocalize and say, enough is enough. We need you to come out and vote. We need you to come out, go onto the website and get memberships, with the parties. With those memberships, we'll be able to email you updates on all of the events that are going on. You'll get notifications on the policies and the things that we are actually trying to create and get your feedback. We need to be organized because the NDP and even BC United have a massive war chest. Massive. And so, we're new. We're a new fledgling party. And so we have to go from the grassroots, and we're counting on you, the voters. And even if you are a PR, get your friends to come out and vote. Come out and volunteer. Now, I will tell you a secret. I don't drive, but I take Uber and taxi everywhere I go. And I hand out these to every single taxi driver. And I had one Uber driver ask me, do you have 100 of these? And I'm like, yeah. So I emptied out my bag and I gave him 100 of these. So it's spreading the word, get the message out there. We need the blue wave on all levels. We really do need you so that we can make the change. And we will also be listening to you once we're in legislature, because the constituency offices will be open all the time. Unlike in Steveston, it's never open. Fancy looking, but it's never open. And we will be open for business.
It took Henry Au 2 years to get his constituency office open. 2 years before you could even shed your voice to him. Kelly Green, Henry Au, Amit Singh, where have their voices been on this? I haven't heard anything. They've literally stood behind Evie of his thing where he then stood behind Vancouver Coastal Health, and they're silent. They're scared to say anything because they're not allowed to. Ebby's not letting them say anything. So where are they listening to us and our voices? They're not. All they want to do is host photo ops. They love the photo ops. Henry Au is still posting stuff. 2 months ago he took those pictures, and he's posting them now as he just attended the event. As soon as Evie does something bad, he's got a positive story. The acting has to end.
Some of the responses so far, the election process and the opportunities that are presented by candidates like this one are obviously immensely important. I want to go back though to the question by the gentleman asking, what can I do? Because there are also nonpartisan activities that I think are related though to coming together in forums like this. And they're, again, I think of Portugal, but it's also true in Swiss referenda and other examples where groups of people were in a crisis and they got through it to some place that's really remarkably better. And every example I know of was preceded by community level conversations. So at the community level, so maybe it would be, Sheldon strikes me as somebody who's got some organizational abilities and interests. I bet he didn't stop using those after the recent stuff that was reported. So, you know, maybe connecting with other people who are in the community, though, and having the ability to talk not just about politics and everything that's wrong, but what do we have that's right and isn't being fully utilized? What are our strengths? Let's remind ourselves of where we really, you know, thrive. And that's a conversation that would lead to who should we vote for. But it's a different conversation. It's going to be different in Richmond, different in North Van, you know, different on the island, every community. And I think it's part of what has helped in other places, and I think it's part of what will help here. When I loved the self-description of being a silent majority. I think that came out of the Richmond protests that I saw on Family Day, and I think that really is quite right, and it's very important to build on that. If I could shift gears to a slightly different topic, but it was something I meant to mention. It was about how did people, you know, researchers and clinicians come up with some of these ideas in the first place. And I can tell you that they're mostly people who moved into addiction from prior work in infectious diseases. It's not the psychiatry department, it's not the clinical psychology or psychiatric nursing in St. Paul's Hospital or Providence. It's not them. In fact, they are, if anything, alienated from this process. So the BC Center for Substance Use was formed as a breakaway from the HIV/AIDS Center for Excellence. And they carry on with much the same program, much the same research partnerships. VANDU DULF, are partnerships of HIV/AIDS research and that legacy of work. So the Stanford Lancet Commission was, in recent years, 2022, to date, the most comprehensive published analysis of the North American opioid crisis, Canada and the US. They described 3 successive stages from heroin into the oxy era and now fentanyl and related analogs. And they say in 49 pages, a lot about what we should be doing, but they say, that's the bulk of the report, but they say there are 2 things we shouldn't be doing. One is implementing a pharmaceutical supply of drugs in the hope of displacing the illicit supply, mainly because all that happens is the availability of drugs goes up net, and problems net go up too. So, and the second was, don't dispense opioids or other drugs from vending machines. Bad ideas. 2, they singled them out. Those are the only 2. Okay. They also say that the main explanation for the crisis in North America in the first place was inadequate safeguards protecting against conflicts of interest. People moving from regulatory rules into education and industry rules with a fluidity that enabled profit taking.
Yes.
Okay? Okay. So that's what they say. Now, here we are in BC. Why doesn't anyone in government talk about the Stanford Lancet Commission report? It's available online. Well, we actively rejected implementing evidence-based practices as are summarized in their report, and instead, we're not only doing 2 of the things that they said no place should do. The former provincial health officer and the head of our health research funding agency were providing advice to government while partnering as co-owners of a heroin company to provide safe supply. The deputy provincial health officer, well, one of them, Dr. Henry was the other under her predecessor, the other deputy provincial health officer formed a vending machine company, currently active across the country, including in some of our worst SROs in BC. The director of the BC Center for Substance Use, also an infectious disease specialist, formed his own pharmaceutical company. There is a culture of entrepreneurialism, but also a culture that is uncomfortably comfortable with the appearance of conflict. Even if a publicly held or a not-for-profit heroin company was a good idea, if you're advocating for it as a senior public servant, it shouldn't be your company.
Yeah, you should be arrested.
So we have to do, in my view, a couple of things. The main thing, and this is an unfortunate thing even to bring up, I have to say, but the main thing is getting on with the opportunity for good work, for improving things rapidly, for getting things aligned across government ministries in a hurry with a plan toward minimizing. People should not be discharged from St. Paul's Hospital after a 3-week stay for addiction and 1 in 5 being discharged to homelessness. That's crazy. We've published that. Out of 5,000 people admitted, 1 in 5 discharged to homelessness after average length of stay of 3 weeks. No surprise, they're much more likely to be readmitted. It's crazy. So government needs to make sure that does not happen, right? Does not happen. We also have to look into how we got into this mess and make sure that our guidelines, the norms that are established, but also the guidelines that are meant to protect us against conflicts of interest are well understood, represent our values, so that we are not led into temptation in this way again. So I appreciate you bringing that up, and thanks for letting me return to it.
But you know, I have something to say on that about the being let out from the hospital. Once upon a time, I lived on Thetis Island in the Gulf Islands. I hurt my hand so badly that they had to send a water taxi over, and I was taken to Duncan by ambulance. No purse, nothing. And I got there at about 6 p.m. And I asked them, okay, the last ferry is at 10 o'clock. I do have someone that's going over, but they have to get home to their kids, so they can take me on the last ferry. Can you please see me? saw 20 people who were walking just fine ahead of me. They saw me at 10:30 p.m. And I'm like, I can't get home now. There is no more ferry. I have no purse here or my cell phone. What am I supposed to do? They paid for a taxi to a homeless shelter for me to spend the night until someone could pick me up in the morning. I have a home. I had a place to go. I was in there for 4.5 hours, needing to catch the last ferry. This is ridiculous, right? So it does happen, 100%.
Okay.
It's 8:30.
Yeah,
Two more?
so it's 8:30, so just
Okay.
two more.
One,
And I know
two.
Kevin wants to ask. a
Okay,
question.
so yeah.
Sure.
One, two,
I'll
three.
just make it quick.
Yeah.
Hi, I'm Marianne. I think I've spoken to all of you before. I've actually moved from downtown in the area of Granville Street, so I'm very familiar with all the sites that are available there. I currently still work in downtown East Side. I often see overdoses. I see a lot of pain and suffering, and I'm really happy that we have all of you here who really do care, who want to put in solutions. And often the 4 pillars of the drug policy I talked about, it seems that BC government, NDPs and Liberals only focus on harm reduction. And there's the prevention, enforcement, and recovery that we ignore. And even Councillor Kashkeed mentioned that when he was working in Vancouver, one of the reasons that it failed was because there's missing pillars there. So maybe you can comment on that.
If the government doesn't have all 4 pillars in place, it's not going to work. It's just not going to work. Like I said before, they just really put you in a merry-go-round. You go to the safe consumption site, or you overdose, they get you back to life, and then they send you back out there to go pick up more safe supply in one of those vending machines. So it's not going to change overnight, but with the current government they have, they're taking the easy way out. They're taking the easiest and the cheapest way out. The only way we're going to get results is if they actually invest money into this and not do a little bit here and do a little bit there. They need to have a unified approach in every city where everybody's on board and doing the same program, same mandate, same care. Like, we talk about pandemics. Dr. Bonnie Henry, this is a pandemic. People are dying at a higher rate than other issues we've had. And we don't see the response that we have gotten for COVID, let's just say. No lockdowns or nothing like that. So when there's more people dying through drug overdoses and this than there are other pandemics we had, they're literally just taking the easy way out and paying Big Pharma. That's all it is. They're literally writing prescriptions for Suboxone and Methadone, which in turn keep sending money to Big Pharma. So we need to reverse that and get Big Pharma off the table here and put all that money into recovery-based projects.
I do want to make one little more comment. Sorry, I've got a sore throat. Kids are coming home from school where you have these recovered experts telling kids that it's okay to do drugs, that we don't want to stigmatize you. I hate that word. But when a 15-year-old comes home and tells his mom, "Mom, today I learned that it's okay to do drugs, that I'm not going to be stigmatized. Is it okay if I can do drugs?" That is wrong. That is the wrong message that we're sending to our kids.
Yeah.
And I hate to say, we should be saying, say no to drugs. And, I'm just really, there was that gentleman, remember, who was yelling at you during the protest? I spoke to him afterwards. And his twin daughters are addicts. They went to a party, and a gangster guy gave them 1 pill. 1 pill.
took me 2 times to use, and I was fully addicted.
And they are fully addicted. And it just took 1 pill. And that's why he's angry, because he doesn't know every day whether his daughter is going to live or die. And he said that they had to give her one of the Mollineaux, 30 doses to try and keep her alive. So I understand why he's angry, but it's not okay. And the government is saying it's okay. And that's what we have to stop.
I was taught in grade 10 that it's safer to smoke marijuana, in a water bomb than it is a pipe. In grade 10, in 2007, 2008, that's what they were teaching. I can only imagine what they're teaching now if they're clearly still going down that road.
And then Ken.
Okay. Well, thank you for organizing this. Really to hear all the insights and experiences. I'm very touched, like Marianne said, that everyone here seems to be people who actually care and not just use fancy words and terminologies and false promises. So I have a few questions. I'll try to keep it short. As a provincial government, how much can we do on the provincial side to stop, fentanyl or inputs from manufacturing fentanyl into coming to the province? I think that's very important for us to do. And how would we plan to help the people who are currently suffering from drug addiction to get into detox and rehab? Because we need a plan to build these facilities, but in the meantime, how do we facilitate the people who are suffering currently? How can we help them with that? And Dr. Somers, did you back up your database?
there was no way to do that. But the good, initially I was really depressed.
Yeah.
And some days I still get a little depressed. But conversations like this are uplifting. The database can be recreated.
Okay.
And with all but a couple of things are lost forever. Very precious things are lost forever. But the big picture, our ability to link information, see where are the communities with the highest prevalence of need, and how well are government-funded interventions serving people in those communities. We can do that and compare against previous benchmarks that have been, that part's okay. We don't need to worry about time. There's no big build-out pressure. The important thing is spending differently. That's the important thing. We have not-for-profit societies all around BC. We have jails, we have detoxes, we have addiction services. None of them, the addiction services, the not-for-profits, are organized around consistent standards of care. There's no ability to match individuals based on their needs to a particular model of service. This is a message that I thought when I pushed it or proposed it to this government, I thought it would be well received, because this observation plays extremely well to pro-union perspectives, because all the people working in these settings should be supported to work to a certain standard, and they should be regulated, and they should be compensated accordingly. The main point I'm trying to make in response to your question is current service providers should immediately be compelled to deliver services that match certain criteria and are moving toward consistency. So we don't need to build detoxes or additional not-for-profits or other things like that. We need to incent through compensation how all the existing service providers provide service, and ensure also that we can measure it at the back end. The information is collected. These are procedural things, but they don't require a hefty build out of any kind.
I just wanted to say something, because you mentioned fentanyl and stop producing it. Fentanyl is used in hospitals. It's also used for a lot of children who are in special needs. So fentanyl may or may not be, you may not have to stop it. Australia, as a matter of fact, still uses heroin instead of morphine.
Okay, so basically, every single drug out there has been from the big pharmaceuticals. Every single one. And that is where people get addicted. Is they go to the hospital and they get morphine, a shot of morphine. And if they have that personality or whatever it is, they come out and they are addicted. So the majority of the folks that I worked with downtown East Side became addicted from the hospital or the doctor, from the big pharmaceuticals. So, you know, are we going to stop making those drugs? No, I think they just have to be a little bit more careful about who they give them to, how much they give to a person. And care afterwards. I think if anybody is given any kind of opioid in the hospital setting, they should have like some kind of follow-up care afterwards to see how they're doing.
I'm going to just make one very quick comment, and that is, I firmly believe that you know, nonprofits do have a great service, but I also think that there's a lot of wastage. And I think that even within the government departments, there's a lot of wastage. And so we need to do a proper audit. And the monies that we can save be redirected to crime prevention. We need to shore up our ports. We need to ensure that the police force has the support. And we also need to maybe have more jails and proper jail terms rather than the revolving door. So it's taking some of the money that is being wasted and then redirecting it so that we have more positive responses. Yeah. I think Kevin.
Last question.
But yeah, Kevin's going to be the last question because he's been so patient.
Thank you, Michelle. Thank you for tonight, and thank you for the guests. It's an informative session today. My question is that strategy, you know, talking politics, right? The recent polls right now that, you know, Sturgeon and NDP are in the leading as a party support, and right now BC United also have a strategy on, you know, have similar concept as you know, against drugs, right? And what I'm worried about is, like, you know, what we're talking about. If you are not in office, right, it won't be materialized. So, like, you know, what is your strategy to differentiate from BC United and make you leading to that? Because the worst scenario is the vote gets splitted, and NDP still, you know, becomes the next government again, right? That's my worst nightmare.
Okay. Yeah, you know, it's really funny because on Friday, I had to take Kevin Falcon to task because his party is doing a little bit of dirty politicking right now. And there's also been a formal complaint against the BC United because they posted a tweet, a photograph that I took that they doctored, and then they branded me as anti-Semitic.
Wow.
So, yeah. So this happened last week. So I took Kevin Falcon to task and I said, that was a dangerous play. You've endangered my life. You've endangered the life of my child. And it's a bull-faced lie. Why would anyone want to run in politics when you play dirty?
Yes.
Right?
Here, here.
He proceeded to complain about how he doesn't have to be the Premier of British Columbia, that he earns enough money, that he's doing this because he wants to get rid of the NDP. And that now the NDP is going to win again because we, the Conservative Party, are splitting his votes. Well, Kevin Falcon and BC United, you're below us.
Yep. Absolutely.
So who is splitting the votes?
Yeah, that's right.
So people who do support BC United need to take a good hard look and say, you know what? I don't want to be with a party that's playing dirty politics. And by the way, they edited 2 other candidates for the Conservative Party with lies. So I honestly feel that, and don't forget, the BC United also have been flip-flopping too, because they did say let's decriminalize the drugs, let's give out free supply. They actually said that beforehand. The Conservative Party has always been consistent and has not changed on their messaging. So who are you going to listen to and who are you going to vote for? Someone who's going to be flip-flopping with the wind and the popularity voices, or someone who's being straight and true in their values and in the morals and listening to the people? So all I can say is that we really do have to get out those votes, and I can't stress that more than enough.
I'll just have something to say on that. Seriously, 6 months ago, I did not, I would say I didn't really know much about the Conservative Party except for what I heard growing up. And my family was NDP. And I haven't been happy with NDP, especially working for a union downtown East Side. Okay, we were unionized, and I'm like, okay, why am I working 12 hours a day without a break and getting no compensation for it? I could not sit down and eat dinner at all, nothing. So, and the union didn't care. So I started looking at things, and I'm like, okay, so definitely not NDP. Okay, don't really care for the Liberals, and I've always been told, don't vote Conservative. Guess what? After talking with Michelle, and my core values align so much with Michelle and what the Conservative Party stands for. And I think a lot of people's core values are there, but again, you need to get the voice out there. You need to talk. You need to educate people on, well, like you said, cut the BS, right? Like, it's what NDP and the Liberals or whoever is promising isn't truth. And speaking with Michelle personally, it is truth. And that is what they stand for.
Oh, thank you. So I want to say that this is a wrap. Sorry, Sheldon, we're like way over time. But I do want to say thank you for all of you for coming out. I do have one little announcement. So this little form here, the phone number's wrong. So if you need to get a hold of me, it's 604-760-7445, not 7745. But please, just get out there, get the word out. You know, there may be an early election. It may be October the 19th. Support your local, candidates. Volunteer, donate, get memberships. Let's get the word out there as much as possible. And let's turn this around and let's save lives.